Welcome to Evidence to Excellence, News in Neuroplasticity and Rehab, powered by the Recovery Project. We want to personally welcome and thank you for joining us today. We're glad that you're here because this podcast is designed to keep you updated on what's new in research and evidence in the neurorehabilitation world. Now, here's your host, Polly Swingle, CEO and co-owner of the Recovery Project.
Welcome to our podcast today, Evidence to Excellence. And it is so fitting that today we're going to talk about MS. And this is March's MS month, so we recognize the disease, we recognize the people. So Jennifer over there has a t-shirt on. So we're gonna dive real deep today in MS, talk about what it is, the treatments out there, some of the evidence out there in treating MS. And I am so pleased that I have a wonderful, wonderful team with me today that is local, that is from Michigan. Each one of these team members work at the Michigan Institute of Neurological Disorders, which has several locations across the metro Detroit as well as Grand Rapids now, correct?
Yes, correct.
Okay, so we will dive a little bit deeper into that. Sponsoring our podcast today is Mind, so as we go through and there's a little break, you'll learn more about Mind and their awesome physicians, their neurologists, their locations, their phone number, their website, and how to get a hold of them. We also are sponsored by the MS Society of Michigan today, which is a great organization that helps support what we do every day, that helps support patients with MS. So anybody out there, if you're listening and you have MS and you have not contacted the MS Society of Michigan, please do, because they have wonderful resources, be able to answer your questions, be able to get to the right healthcare professionals that can really treat you for your disease. So let's get started, and let me introduce this wonderful team that we have here with us today. So right next to me, we have Sonda Rossman. And Sonda is the MS Center Research Director. Sonda leads the implementation of an expanding multi-model and cross-disciplinary research program and supports the network that's developed with outside collaborations on a national level. And one thing I do have to add is having Mind in this area, they are recognized nationally and have the best physicians for MS in the area. Sonda and her team has kicked off research with clinical trials for, help me with the word I asked you.
Tysabri.
There we go. Mind now has some of the most novel therapies available for clinical trials and are excited about future breakthroughs for MS therapy. And I have to say, being involved in neuro rehab for over 35 years, it is amazing to me how many different drugs are now available for this diagnosis. So kudos to that. Sonda's passion for advancing the care of MS patients stems from her own experience with the disease, being diagnosed in her 20s. Through her efforts, Mind's MS Center and MS Research has grown into one of the largest private centers available in the country. That's pretty awesome. Katelynne, help me again.
Parisek.
You would think that's easy. Sorry about that. So Katelynne is a registered dietitian for Mind. With a master's degree in dietetics, she has always had a passion for helping others achieve happiness through healthy eating and lifestyle changes. Katelynne started and implemented a nutrition program focused around symptom management and prevention measures for patients living with autoimmune, inflammatory, and neurological conditions. Working side by side, she helps those patients create attainable goals, desire a meal plan to reach these goals, and provides them with a skill and knowledge necessary to be successful. Katelynne's main goal is to help her patients feel in control of their life and take the stress away from eating. Welcome. I have to say I'm very interested in this topic. There is so much in science these days on the effects of the food that we put in our body and how they affect how we feel, the disease processes as well. And I think we're learning more and more about the effect of inflammation on our bodies and how it is such a root cause in so many aging disorders and diseases that we're seeing, as well as some of these neurological diseases. So I'm really excited to hear what you have to say.
I'm excited too.
Next to Katelynne, we have Sarah Johnson. Sarah is the lead nurse practitioner for Mind's Multiple Sclerosis Center. She works directly with Dr. Martin Belkin and Dr. William Boderis and helped co-found the MS Center. helped co-found MS Center's MS Wellness Check program, where Mind's MS patients receive baseline and yearly follow-up testing specific to their MS diagnosis. We're going to dive really deep into that program here in a little bit. She is certified in MS nursing and passionate about making a difference by improving everyday lives of patients with MS. Thanks for joining us, Sarah.
Thanks for having me.
And then next to her, we have Jennifer Butterfield. Now, Jennifer, she has a lot of credentials, guys. Hang on, listen to this. Jennifer is the Chief Nursing and Strategy Officer for Mind. She has been a nurse for over 20 years and is the former CEO of 2 of the surgical partner facilities, Lakes Surgical Center and Michigan Surgical Hospital. Wow, that's impressive. Jennifer is a certified administrator and is actively involved in several organizations for improving national healthcare guidelines. Under Jennifer's direction, Mind is working towards increasing community outreach for the practice and expanding their MS neurological specialized infusion centers. And again, we'll fill you in on all that in just a little bit. Mind now has 4 infusion centers serving Metro Detroit and the Grand Rapids area. Thanks for coming.
Thank you.
Thanks, guys. We got a lot to talk about.
Yep.
So let's dive deep into this. And first, let's talk and share with the audience the basics. What is MS and how is it diagnosed?
Well, I'll take that.
Okay.
So, what is MS? So, MS is multiple sclerosis. It is an autoimmune disease of your central nervous system, which we also call the CNS. And so the central nervous system consists of your brain, your spinal cord, and your optic nerves. And you have thousands and thousands of nerves in your central nervous system. And these nerves send signals from one part of the brain to the other. It sends signals from your brain to other locations in your body. And it sends these signals through nerves. We also call them neurons. And a signal or an impulse is sent through this neuron down a rope-like substance to send the signal down to the next neuron. Sorry. And your axon is insulated with a fatty substance called myelin. Okay. The myelin's important because it sends that signal very smoothly and effectively and quickly. And when the signal gets sent to its intended location, the function is performed. And so in multiple sclerosis, I mentioned earlier it's an autoimmune disease. So our immune system fights infection. So it sees bacteria and viruses as foreign and it attacks those and cleans that out. But in an autoimmune disease, your immune system behaves abnormally and it sees this myelin, this fatty substance on your nerves, as foreign, and it attacks that myelin. And it causes inflammation and damages the myelin. Sometimes it can damage the axon. And when that inflammation is gone, the damage is there. Then we call it scarring. Scarring is also known as sclerosis, and that's how MS got its name. And so then when signals are sent through that pathway, the signal's durable and patients end up with symptoms because of the MS. Sorry, I know that was a long explanation. I think it helps understand better how, when we talk symptoms later on, how that process happens.
Absolutely. So how do you diagnose if somebody has MS?
So there's not one single test that diagnosed MS. It's not a single blood test or a single symptom or physical finding. Really, to diagnose multiple sclerosis, first off, we have to rule out other diagnoses or other conditions. And so there are several blood tests that are ordered to help rule out those other conditions. And then the other factor we use is an MRI. So an MRI is a tool that we use, a diagnostic tool that we use to look behind the scenes at the CNS and look for that scarring. We sometimes we call it demyelination or a lesion. And so there are 2 criteria that have been met. It's I guess there's a certain criteria. It's called Mcdonalds Criteria. It was revised in 2017. And they are set up guidelines to help us diagnose MS. And so to get a diagnosis of MS, we have to have evidence of damage in at least 2 areas, 2 different areas in the CNS. And we also have to have damage that have occurred at 2 different points in time.
Okay. Very clear, thank you. So what are some of the signs and symptoms that people may present with
So
If they have MS,
So
okay.
as someone who has MS, was diagnosed, actually my first symptoms, I was 20, and I presented with optic neuritis in 1991. So as Sarah said, McDonald's Criteria actually came out in I think 2001. It's been revised over the years, amended because we've gotten so much smarter and better at these things. But at the time in 1991, I was 20, there were no treatments and there was something called closure criteria. At that point, the only way to diagnose was really two very separate definitive clinical attacks. And one of the things that Sarah didn't say is we do use MRI and lab work, but also clinical presentation. So if a patient presents with, for example, optic neuritis is a very common occurrence that can happen in people as their first presenting symptom. They could go anywhere from sensory disturbance to spasticity to weakness. Kind of can run the gamut because if you think about it, your brain and spinal cord are sending, if there's a disconnect between the conduction of the nerve, it can't get the signal across, and so that can manifest in a lot of different ways in a lot of different people. So many times when you're talking to patients, what you find in taking their clinical history is maybe they actually had symptoms, further back, in thinking about, maybe the symptoms were there before they actually, little things that they sort of dismissed or ignored.
Will it come and go? Just sometimes the symptoms may kind of come and go, and then they
it
become a
lasts
little
and
bit.
wane, and usually,
Yeah.
but for a typical MS attack, it's typically lasts longer than 24 hours. And if it's significant, it probably requires intervention with an anti-inflammatory like a steroid.
Yeah, because a lot of our patients will say to us, first thing was the optic neuritis.
Yes.
So what were some of those symptoms? Was it blurred vision?
So it can kind of run the gamut from double vision, blurred vision,
Okay.
partial vision loss, complete vision loss. In my case, I had pretty significant vision loss in my right eye. But at the time, we couldn't make that diagnosis because, again, I only had one clinical attack. There were no treatments at that time.
Right.
So then it wasn't until about 4.5 years later when the left side of my eye started going numb, became weak, ascending up from my to my middle of my
So is that kind of a gradual? Your symptoms
It
typically
was,
are
for me.
gradual. It's not you wake up in the morning, you're like, huh.
Usually, I mean, I guess it can.
Okay.
Again, this kind of can manifest. And depending on sort of what happened prior, so if somebody did something really exhausting,
Yeah.
it can sort of manifest much more quickly. In my case, I woke up and I just couldn't see out of my right eye and couldn't figure out why, and, but I looked okay.
Right.
Everyone's like, you look fine.
Exactly.
Yeah.
Well, let's take a break. And again, before we take a break, want to thank our two sponsors, which is the Michigan Institute of Neurological Disorders, which is absolutely going to be more information on our break that's going to be showing, as well as the MS Society, and we'll be right back.
We are a movement by and for people affected by multiple sclerosis.
Until we end this disease forever, we will do whatever it takes
to accelerate breakthroughs.
We believe that we are stronger together.
That nobody should face MS alone.
We will be by your side every step of your journey.
From day one.
We'll be your partner through the challenges.
Sharing ideas and finding solutions.
We believe
That people live better lives
when they are understood and supported.
It's hard to hear.
But you look so good.
When you feel anything but.
Or to feel like MS is the only thing people see. We will be there for your loved ones so they can be there for you.
we'll shine a light on what it means to live with MS.
till the rest of the world understands.
We believe that everyone deserves affordable medications.
A doctor who knows MS
And a healthcare system that puts you first.
You should never have to choose.
between paying your bills
And getting the care you need.
We will make sure your voice is heard loud
and
Clear.
will be your champion
from the halls of Congress.
to City Hall.
We believe that you should be able to plan for the next 10 years.
Even the next 10 minutes.
Without MS getting in the way.
Complex problems take many solutions.
Coming together in just the right way.
We'll be there to help you piece it all together.
We'll work every day.
So you can get what you want from life.
Even while living with this disease.
We believe that no one else should have to face the fear
and uncertainty
of an MS diagnosis.
And that those that have MS
should get back what they've lost.
Curing this disease takes a global effort.
We will fund the most
promising leads
and gather
the brightest minds
to find a cure
as fast as possible.
We'll be unrelenting
until the very
end.
We believe that we all have something to contribute.
Whether it's time,
money,
connections,
or sheer passion,
there is strength
in numbers.
We're calling on you to join us.
Join us.
Join us.
Find your place in this movement.
We need you.
We need you.
We need you.
Together, we will create a world free of MS.
Welcome back. So let's just continue our discussion. What are the different types of MS and how are they different? I think, Sarah, you're going to talk about that a little bit.
Yeah. So there are 4 types of multiple sclerosis. The most common form of MS is relapsing remitting multiple sclerosis. It accounts for about 85% of those diagnosed with MS. So relapsing MS occurs when a patient has a relapse. Sometimes we call it an exacerbation or an attack, but it occurs when a patient experiences a new symptom or a worsening of an old symptom. And this worsening or this new symptom has to last longer than 24 hours. Sonda mentioned that earlier. And it has to be free of infection and other external factors. And so that worsening can last for a period of a couple of days to a couple of weeks, and then it's followed by a period of remission where patients are stable and then they have another attack. And so that is the course of relapsing MS. Over time, untreated MS does transition into secondary progressive MS, and this occurs when, there's 2 kind of subtypes of secondary progressive MS. So non-active secondary progressive MS is when an individual doesn't relapse anymore, but they notice this gradual decline. But you can still have active secondary progressive where patients do relapse and progress after the following a relapsing course. The third type of MS is called primary progressive MS, and this is an individual who, from diagnosis, they have a decline in functioning and mobility, and they are free of relapses. And then the fourth type of MS that is out there, it's very uncommon. It's called progressive relapsing multiple sclerosis, and this is when someone declines from functioning but also has relapses intermittently.
So, is there a cure? No. So what are the treatments available for MS?
So our treatments for multiple sclerosis are aimed at modifying the immune system. And so, Polly mentioned earlier, we're fortunate to have so many options. There are 18 options that the National MS Society has listed on their website, and you can refer to that and go through all the individual medications. But we really have 3 kind of three types of route of administration of medications. One is an injectable form of an MS therapy. We also have oral pills and infusions. So they all have pros and cons. It's important to talk with your healthcare provider about what is the right choice for you, and making the decision together with your healthcare provider.
Okay, and that's why it's so important to see a physician, a nurse practitioner, a PA that is an expert in MS. Absolutely,
yes.
Absolutely.
I just want to tap on the cure thing because it's such a, so when I was ultimately diagnosed in 1996, the cure was 10 years away, and we're not even close to a cure. But a cure is very different for very different people, right? A cure preventing the disease, if you're getting the disease is one thing, so that's like a vaccine. Stopping the disease without risk, because a lot of the more efficacious medications are great at really halting the disease, but there's a lot of risk sometimes associated with those, and so you have to do a risk-benefit analysis. And then you have the actual repair damage that's already been done. So there's sort of 3 different classifications, I think, in terms of talking about a cure that people sort of think it's this one thing, but it isn't. It's more complicated than that.
Right.
And then on top of which, we still don't understand why people develop MS. Why is it more dominant in, Scandinavian countries or our kind of climates? Michigan has a higher preponderance of patients than other, areas. So again, there's
And
a
it's
lot of
interesting because I get questions from my patients that say, is it genetic?
Right.
And
Well, and we know at least, so I haven't seen any updated data, but in monozygotic twins, right, they share the same DNA. You would expect if one twin got it and it was genetic, then obviously the other twin would get it. But studies show that only 50% of the time does the other twin get it. So therefore, it can't be fully genetic. However, Sarah can attest, and we have families with 5, 6, 7 siblings.
There is a genetic component to it, but it's not passed down through a DNA chromosome.
or maybe that's not recognized yet, or they haven't discovered that yet. With so many of our diseases that we're seeing, as we get more sophisticated.
Is there a genetic predisposition with some environmental factor?
Correct.
Then that gives the perfect storm for you to develop.
And you kind of hear that theme a little bit, or that thought process with a lot of the autoimmune.
Right.
What is that combination? Exactly.
I do want to touch base one more comment about treatment. So MS is a little two-sided treatment. One, we're treating the disease, and one, we're treating symptoms. And we're going to talk more about treating symptoms and really looking at lifestyle changes, which is a big push that we're doing in our office now, is looking at lifestyle changes, rehab, nutrition.
Right, because it does make effect,
Because it does
absolutely.
make an effect, so it is a little
So
two-sided.
let's kind of move right into that. So in my experience in working with MS, the patients that come in have multiple symptoms. Their muscles may be involved, where they have weakness or spasticity. Their nervous system will be involved. Vision, of course. Some of them have cognitive issues, bowel and bladder issues. Because they're not as mobile, then they may develop skeletal issues, if it's joint contractures, if it's osteopenia, osteoporosis. So many systems in the body, your breathing can be affected from this disease. Now, at Mind, I want you to share with us, you guys definitely are a multidisciplinary team approach. So can you share a little bit about what that looks like in your practice?
Sure. Well, we've tried to make Mind a one-stop shop in a way. And our team's led by our neurologist, obviously, followed by our advanced practice providers, nurse practitioners and PAs like Sarah. We have a large nursing staff, techs, medical assistants, all part of the team, adding a nutritionist and a registered dietitian, I should say, and such. So our practice has at our fingertips state-of-the-art MRI. So we've got 2 MRIs in our building in Farmington Hills that are state-of-the-art. We have 4 infusion locations now. We're in multiple locations, so we have 4 locations as well across the Metro Detroit and into the Grand Rapids area. And we've got our clinical research team. We do spasticity management, therapies like Botox, and we've got pain management procedures, we've got rehab services, EMG, EEG, and just all of that is just in that one area to support the many multiple sclerosis therapies that are there. And obviously, oral medications, infusion medications, and injectable medications, training, education, all of those components are involved at all of our locations.
And what a concept, because many of these patients may have mobility difficulties. It's not easy for them to come out of the house to go see the doctor. How often, if you need an infusion, are you going weekly?
It depends on the infusion.
It depends on the infusion.
Probably monthly is majority of the infusions that we have. Every 6 months is another. And then there's people, depending on their circumstances, that might be slightly off of those target time frames. But it's unfortunately a pretty busy infusion center, so we have a lot of
Agree, I've been there, and you guys are extremely busy, but I love the concept of that one-stop shop, because it just makes it easier for our
We'll have our patients
patients.
see their physician, go have their MRI and then come and have their infusion in one day. So that's, you know, in
It's
any other
optional. Yeah,
location,
Yeah.
that would be like 3 different stops. You know, you'd have to go to 3 different locations to do that. So really nice that you just come to the one location to make that happen.
So, you know, I just wanted to add, I mean, I'm kind of the rehab person over here, and I know that we work very closely as well with you guys and providing a lot of the rehab and the evidence out there that is showing that, as Sarah said, you know, we see these people and yes, they're getting their medications and hopefully we're getting them to where they're maintaining their function, but also with physical therapy, occupational therapy, other type of exercise, we are seeing through science that it is so important to exercise because it does help in gain strength if you're losing strength. It does help with their cardiovascular system, with breathing, even their mental, because we know that exercise has this effect on motivation, on depression, on anxiety, that when some people get this type of diagnosis, they're like, I don't want to lose hope, but boy, my life is changing. You know, the people around me are changing. Maybe I'm not going out as much as I used to socially. So it's just important to get out and do that rehab component. We're going to take another break and we're going to come right back and start talking about the project and the clinic that we're going to be working together with and dive a little bit more into the dietary side, which I'm so excited. So we will be right back.
Progressive, effective, and focused neurorehabilitation. The Recovery Project, an industry-leading practice working to produce hope and life-changing results to people with spinal cord injuries, traumatic brain injuries, neurological disorders, and other conditions. The Recovery Project's experienced, compassionate team of physical therapists, occupational therapists, speech therapists, and trainers utilize the latest evidence-based techniques and state-of-the-art equipment in their Livonia, Clinton Township, and Lansing clinics to develop customized, comprehensive, high-intensity training programs for a variety of injuries, diseases, and conditions. We consistently reevaluate each of our programs and incorporate the most up-to-date techniques. We also offer an array of exclusive specialized equipment, including functional electrical stimulation, FES devices, red cord suspension training, Bioness, light gait bodyweight supported treadmill training, the Balance Weaver vest, and much more. At the Recovery Project, we help everyone feel fit and healthy. We understand that an active wellness journey is the process of making choices toward a healthy and fulfilling life. That's why we've developed a variety of cost-effective and accessible wellness programs to ensure our clients maintain and build on the benefits achieved during therapy. To find out more about the Recovery Project, contact us at 855-877-1944 or visit our website at www.therecoveryproject.net.
Welcome back. One of the things that I always dive deep into is research whenever I do these podcasts. And I'm kind of a research nerd because I think science is so cool and exciting of what we are finding now in medicine. So I want to know, what kind of trials are you guys working on right now at Mine?
So I have about 14 clinical trials, which is it's a lot for a facility like ours. And you know, when we started this MS Center 20 some years ago with the concept of one-stop shopping, but also there were no infusion therapies available. There weren't a whole lot of treatments actually available. And so it was the hope of seeing what was coming down the pipeline and wanting to be a part of that and giving our patients access to things they otherwise couldn't have. And so, you know, the fact that we have 18 therapies now, and Mind has been a part of most of those drugs in some form, whether it's early on or through FDA approval, which is really exciting because we were told we can't do it. We're not academia, we're not hospital.
Yeah.
So, and at the time, my husband and I, who was not my husband at the time, but we decided, like, no, like, I think we can do this, and we can actually do it better, we can do it more efficiently. We can make a significant contribution, not at a molecular level. We're not creating these molecules in a lab. We don't have that ability, but we do have the ability to do anywhere from phase 1 to phase 4 trials, and typically I focus on phase 1 to phase 3. Phase 3 is basically the trial that the FDA makes the decision of whether or not to approve a drug. So right now I have about 14 trials, actively only recruiting for one. Most of them are closed and fully enrolled. The one that I have is for subcutaneous B-cell therapy, which would be a little more convenient than infusion for some of our patients. We'll see what happens with that. There is a subcutaneous B cell therapy that will be coming out soon as well. But it's just incredible to know that, like, when I had my first symptoms, there was literally nothing. And when I was diagnosed, there was one therapy available. And now here we are in 2020 with 18 therapies and another, I don't know how many are going to be approved. A couple this year are launching very, very soon. And but kind of the next big thing is repair therapy.
Yeah.
And so, and we have actually we're part of there's only a couple molecules out there that do repair therapy, and we're part of those trials, which is really exciting.
That is so exciting.
Yeah, I mean, it's complicated. It's not this perfect, it repairs, all the damage and you're back to normal, but it's promising and exciting to, one, be able to give this to our patients as a possibility, and what that ends up looking like, we don't know yet. We don't have those results yet. But, probably more the people who don't have significant damage yet, can we preserve any, like, damage that we're not fully seeing yet, but, maybe it won't manifest itself, plus controlling disease with disease-modifying therapies, as Sarah was talking about. So it's, this double approach.
Right.
So you have disease-modifying, let's control the disease, and then what can we do to repair the disease?
Yeah.
And so we have 2
symptoms.
trials that are enrolled now, and then I have another one that will be coming out on oral options.
That just tells me that as a consumer, that if I had to seek an MS center, that I would want somebody that had that knowledge base of, here's what's coming down the pike that potentially could help me as a patient, and really looking outside of that traditional standard to say, here are some other options. And we're not just looking at managing your disease, but also you have these symptoms and maybe we can try this. So that is really exciting to hear that that's available in our area for our patients. So thank you for doing that. So Katelynne, I have to talk to you because I am so interested in what you're saying. So fill us in on the work you're doing, the evidence out there on what we put in our bodies and how that affects not just MS, but other neurological diseases and inflammation.
Yeah, so to kind of start off, when I was hired to kind of implement a entirely new nutrition program for Mind. And like Sonda said, I think one of the hardest parts for me was that MS is kind of an invisible disorder, and a lot of other neurological and inflammatory conditions are. So there's really not a lot of dietitians out there for this condition, especially. So when I was doing research on diet and what I could start implementing, there was really nothing. So that was really complicated. So I kind of started deciding, okay, well, I can look at the certain symptoms because there's a lot that I can do with individual symptoms. It might not be specific to MS, but it is specific to those symptoms. So in terms of, how can a diet be helpful? It's definitely helpful in, symptoms such as fatigue, pain, muscle weakness, constipation, dehydration. Those are all common to MS and neurological conditions. In terms of diet, this is an anti-inflammatory this is an inflammatory condition, so you do need an anti-inflammatory diet. So just including a lot of fresh fruits, fresh veggies, really focusing on the veggies. Lean meats, so like chicken, turkey, fish, always good omega-3s there. And then whole grains, so, just foods that are gonna be fuel to you, especially, in your case where you have 2, you wanna make sure that we're fueling their bodies to be able to perform these tasks. So it's definitely been interesting.
And one of the things I want to add, because one of the big symptoms that we hear and you guys hear is the fatigue.
Yes.
I hear this, I'm a physical therapist, I am too tired and you want me to exercise and do what?
Yeah.
So to hear you say that, because it's almost a double-edged sword that I tell my patients, is that you're tired, so you don't want to exercise, but the more you're sedentary, the more fatigue you're going to get.
Yeah.
So as we get you in this exercise program, you will eventually feel better, but you have to get over that. And to have that support and that other team member to say, let's also look at what you're putting in the body that can help with that is huge.
Yeah, it also is huge. A lot about timing of meals too. So, some people, they get busy during the day if they're working and they skip meals, or, they don't eat breakfast. And that's a big thing that I always am, recommending. So I make sure that my patients have a schedule, so at least they're thinking, okay, it's 3 o'clock, I should probably have a snack. And also incorporating snacks, because a lot of the time, their meals might be quick, on the go, they might not be eating enough, they might be eating, too much sodium, so I always just make sure my patients always have the skills and tools they need to read food labels, the right foods. Yeah. If they do want to reach for convenience food, I give them guidelines like, hey, if you're at the store, read the labels, this is what we're looking for. So just giving them all the tools and kind of saying, okay, I've given this to you, now go do it.
But, just giving them the education and having that conversation, because a lot of the times is, if you are on the run, I'm guilty. Mm-hmm. I'm hungry, I'm on the run, do I just grab something that's convenient in a wrapper and processed and not real food? I don't think there's anything real on that label. Is to really have that conversation and say the importance of, let's take the time, meal prep, let's be prepared, let's make the right choices, because in the long run it will just make a huge result on the way you feel every single day.
Yeah.
So that's awesome. Yeah. So I want to dive into what we're going to be doing together as part of the wellness visit. So I think, Jennifer, you're going to fill us in a little bit about the background on that.
Yeah. So our wellness visit, I'll let Sonda talk a little bit in a second about kind of how it stemmed and sort of why we ended up doing this, but as we kind of had a strategy meeting and we were talking about kind of taking our practice to the next level, we talked about wellness and how it's important to take a deeper dive in a broader approach to kind of what we're seeing in terms of our patients. And so we can treat with medications and infusions and whatnot, but we wanted to go a little bit deeper and take a broader approach to what's going on really in their lives. And so wellness sort of came up because that's many things, right? That's social interactions, that's family interactions, it's maybe your finances, it's how do we eat? How do we exercise? Are we happy? Are we depressed? Are we a resilient individual or not? And all those factors play into your overall health and wellness and how compliant you are with maybe your treatments and whatnot. So all of that was very important and sort of why it was created. But I'll let Sonda kind of talk about sort of that nugget that sort of sparked this whole conversation and why we got there.
Yeah, so there's a research initiative that's actually taking place that stemmed from a former physician at the Cleveland Clinic. And we were one of 20 centers in the world picked to participate in this multiple sclerosis performance testing. Mm-hmm. And it's an iPad-based test that will measure patients over time with upper extremity function, lower extremity function, cognition. So right now the tools in research for assessing patients' disability is something called an EDSS. Mm-hmm. And it's very heavily weighted on whether or not you can walk and whether you use an aid. And if you use an aid, bilateral aid, you're automatically going to score. There's no real sort of other measures that you're capturing. I mean, it asks about depression, but it's like a very cursory thing.
Okay.
And so I think in '97, the MS Society actually convened a group of physicians to create something called the MS Functional Composite, which is a 25-foot time walk speed test, 9-hole peg test, again, upper extremity, and then something called the PACE-AT, which is a cognitive test that most neuropsychologists will tell you is awful. And that now more recently has been replaced with a little bit easier test to administer and a lot more sort of efficient in terms of cognitive thing. And so in doing this, it was like, why aren't we want to do, I mean, hopefully this initiative will work out and ultimately this can be done in every center for every patient and it becomes the norm, but it's not ready for prime time yet. So, but what can we do as a center to try to address these things and start to measure these so we have a really good idea? I mean, these are patients that are coming to us for 20 some years, if not longer, and sadly, if they're family members or friends or people that they run into. And so we wanted to, we want to be better. We want to do better. That's what the premise of the MS Center was. Not perfect, no place is perfect, but again, what can we do? And so one of the things is it just makes sense. Let's get an assessment of, upper extremity, of of lower extremity, and then this cognitive test, and it's called an ST&T, Simple Digit Modality Test. And so it's a quick way to just kind of see, are there any changes in, any changes that we're picking up, over time. And so the hope is that, it's a snapshot in someone's life, but that we can actually see maybe the medication seems like it's working because they're not having relapses, but that doesn't mean other factors of their life haven't changed. And that we can maybe then need to intervene, as opposed to just using MRI.
Exactly, and I think having that is when we measure them, we can say, look at your status quo, you're doing great, or this is showing a little decline, and maybe the medication is holding steady, but is there dietary that you need to talk to? Is it that you're not in physical therapy, that we can take this team approach and really give that patient what their need is? So super excited to get that started. We're going to be starting that program in May of this year. So on the podcast, guys, we're going to wrap this up. There's going to be all kinds of information on how to contact the team at Mind and get involved in seeing the specialist doctors on infusions and being involved in this wellness clinic. So that will all be there for you. I want to thank you guys for joining me.
Thank you so
and
much for
happy
having us.
MS month.
Yes.
And we hope to see you. And yes, a week. And we hope to see you soon. Thanks.
Thank you.
Thank you for listening to today's Evidence to Excellence News in Neuroplasticity and Rehab podcast. We appreciate you and hope that you come back every fourth Tuesday of the month to get more of what's new in evidence and research in the neurorehabilitation world. To learn more about the Recovery Project or to find out what we're up to next, you can visit us anytime at therecoveryproject.net.